Good evening. I think this is your forum and you're the important people, and this is all your question and answer. I'm just a sort of merely there to answer your questions. But response we had, I thought it's better I go along with what is commonly asked and then individual all the problems. At the end of these slides, there is a contact for me at NHS, but at both ends, you can communicate with us. Any questions? It doesn't matter where you are in UK or abroad. We will try to accommodate and we can speak, communicate all your anxieties, problems, anything. Not the financial problems, but problem with the Pectus, I can help. Okay, so I think without this thing, let's go on the next slide. So I think the question is, what is Pectus Excavatum? It's a popularly known as a funnel chest, or it's a dip in a chest, dent in a chest. And this is far more sort of affecting people different ways. And it's a part and parcel of something happens to your chest. It can be associated with the scoliosis, spinal problems, so many other problems as well. It usually occurs around 1 in 400 to 1 in 1,000 birth. So it's pretty common. It can be mild, and the funny enough is that it's around 4 to 6 times more, 4 to 6 male to 1 female child. So it's very common in boys than the girls. And also a reason because of when the breast developed, often it's not noticed. Luckily or unluckily for us is that most of the North America and Europe, Pectus excavatum is far more common than there is something called pigeon chest where the chest is protruding forward. Mostly causes of this is not very known, but it's familiar. You see in siblings or cousins, brothers, somebody in the family can happen, or sometimes it could be just by its own. There is something called, you must have heard, called Marfan syndrome. That is quite commonly associated with the Pectus excavatum or a funnel chest. And sometimes if you got a scoliosis or a spine issues can associated with that. Famous Marfan was Abraham Lincoln. If you look at him, you'll remember what Marfan syndrome is. And what can it cause? These are some common questions. Mostly children will remain healthy without any major problems. But when they grow up, you will see that they have an exercise intolerance. That means when they do exercise, they get tired quicker than the other of their peers. Sometimes they get a pain. They have a posture issues. They always have a sort of hump, and often their posture change, and very rarely they have some heart issues. It can be associated with the heart problems. And there's about a common one called Ehlers-Danlos syndrome, where you get a all elastic body, and they have a problem with their aorta, and they can also have this problem. But besides that, they can have palpitation issues, heart rhythm issues, and most commonly, it's a psychological. They could be very anxious or withdrawn and depressed. And I always said that the treatment for this is not life-saving, but it is life-changing. And I was so surprised, one of my satisfied patients gave me a card. He's a young chap of 17. And he said, I remembered you saying this. And then he said, I changed his life. And he gave me a big thank you card. And it was quite touching. Next one. So I think this is what I said, is that around 85% of these cases, you can see it in first year. Moms usually know that there is some prominent depression there, but often you think could be there's a baby fat around, the tummy is full and things like that. But by 12, 13, you know that there is a definite depression. There is a 40% familial history. That means people have it in their families and you can find it. It's a familiar, but it's not congenital. Congenital means it's not genetically transmitting between different groups, but it's just the way it is. More frequently, you see Marfan syndrome. So I think there is How do you fix it? I think there are several ways you can do it. You don't need a surgery. Most often, you don't need any of these things to do. But can imagine young person with a dent there and quite wearing jumpers and everything, even in summertime, is not nice. I started all this treatment because I had a patient sitting in my clinic and his mom was there. He's around 16, 17. And I asked, what is it? Let's have a look at your chest. And he wanted his mom to go out before he could show my chest. And I was quite touched because if you can't show your chest in front of your mom, then it's definitely affecting that young lad. And with that, I thought I better do something about it. I went and saw in good centers, trained myself. It was in 2009. And in 2010, started offering the NUS procedures to patients. And he was my first patient. When I saw him in the follow, he didn't come with a mom, but he came with his girlfriend. So it was such a life-changing for that little boy. So there are lots of treatment. Best thing, if your child is young, you should encourage them to swim, because swimming is a good exercise. When you move your arms, it can also make your lungs inflate and prevents it depression getting worse. And as all you do in your gym, Pilates and stretches, you should get your children to do that. It always helps making it worse. The ideal age to correct this is between 15 to 18. It works out well in UK because imagine if you do a surgery when you're just finishing GCSE, you get a long 8 weeks holiday, and then they can recover. And then when they go into senior school or uni, you can remove the bar and they can go to uni. So we usually remove these bars between 2 to 3 years. But that's when we talk about treatment. The next one is.
Mr. Kolvekar, just to interrupt you slightly there, we have had 2 or 3 questions about the vacuum bell and how effective that can be when it's used on younger children. Have you got some, you can perhaps answer that?
Yeah. I think there are other treatments where there is something called Ravitch, which is, we don't do that many, but sometimes if there is a uneven chest, we can do that where you take the cartilages out and straighten the chest and put a bar there. But it's a major operation. You need a big cut, or in the girls, we get cut under the breast. The vacuum bell. I think vacuum bell is touted upon as another choice and a cheaper option. It is useful in very small group of people. We used it in the past when people have a Poland or Jessen syndrome where the chest wall is absent and the whole chest is sucked in when the newborn and you cannot, they can't breathe. And their vacuum can lift the chest up and get the child recover. Vacuum bells are not very useful for adult. A problem with the vacuum bell is it sits in the front and it sucks the sort of a front of it and hold it up. But often we see that it sort of affects, bruises the skin and can cause a problem. The compliance is a problem because it's quite a cumbersome thing to put it on. But with the decommissioning of any surgical treatment for pectus, a lot of people are trying out, but very lukewarm results. I think you shouldn't waste your good-earned money on it unless you're very young and worried about it. Then you can use it. There are a small group of people it works. Mainly if you're elastic, young, you can see instantly it pulls up. Grown-ups, I have my doubts because when I did a NUS procedure on this, amount of pressure I use to lift the sternum up, I can't imagine the suction at that level can help you. But it's a cheap version of a tryout. And if there are issues with the finances and worried about, you can use it, but it does affect your skin. There's always constant suction effect on the skin. You get big bruises and patches. But there are a few people have used it in your group and they are quite happy with it. Initially, it looks good, but I don't know the long term. I've seen some patients use vacuum valve and then whole chest is regressed and I had to operate on them. So that's how I have seen it. But before you go for it, always check with them. And if your child is younger, very young child, you should not use it. I think around 12, 13 could be okay. But before that, you shouldn't use it because it's quite a painful for younger ones. The braces, there is a big company keeps sending advertising to your website. The braces won't work on excavatum, but if you get those rib flaring where your rib cage at the bottom twists up, those are the ones the braces sometimes can help to push them down. But on itself, braces have very limited effect. They work magic in pigeon chest. If you got a pigeon chest where the chest is protruding, it works. I do other things called Pectus up. This is another bar, which I'll show you, which pulls your sternum forward and fix it. It's a sort of French, it's a Portuguese system. It works, but it's very new. We are the only few centers use it, but we don't have long-term data. There is one very fancy one this day and age called 3D Anatomica, which is we take your CT scan of your child. They should be fully grown. Otherwise, if their growth spurt comes, it may not be ideal for them. But if you're around 18 and above, or you're older, this is a good treatment where we take a scan, but then we get a 3D printer designing the silicone implant for you. And that looks really good and natural, but it's only aesthetic. It doesn't correct anything else. Then we had a question about severity. What is my Pectus is severe or not? We have a lot of indices. There are around 26 ways you can measure, but this is the very popular called Haller index. I think he was a radiologist. He just passed away, I think last year, who used to do a CT scan, and then you measure horizontal to vertical. What it means is it shows how deep it is. Can you imagine, you look at that picture, the breastbone is going down to the spine. And normal chest usually is around, Haller index is less than 2. And if you get 2 to 3.2 is around mild. You probably don't need much treatment other than aesthetic. Moderate is between 3.2 and 3.5. If you're above 3.5, that is very severe. And probably better having a treatment, because when it's 3.5, your heart, if you see in that X-ray, the heart is squashed. This heart is so squashed on the left side by this. So it does squash it, and it can cause you palpitations. It can cause you leaky valve. And I had a patient who had a very dedicated dad. He was taking this patient to different places. First, they said he's just a behavior problem. He said he's just faking it. Then other people said he's got some fancy epilepsy. They were treating it. But father knew about his son, and he said something wrong. Then he went to see a cardiologist, and then he sent it to me. And what we found, that because his breastbone was pressing and rubbing on the heart, every time it's sort of stressed things, he used to get, heart is to stop and he's to collapse. We did a tilt test. And when we corrected him since then, he never had that sort of a blackouts and collapse. So these can happen, but they're very rare. And I don't want you to worry about your children. It happens in very, very rare group of people. Because I exclusively do this, that's why I see this. But almost 90% time, your child will not have any of these issues. I'll show you some pictures. One of the challenging one. If you see here, this young chap I operated him on in India. Nobody wanted to operate or do anything. And his father, who was a retired soldier, was going to different hospitals. So they showed me this. And this patient was already rejected by people who do NAS across the globe. They said it's non-doable, it's too deep. His breastbone was touching his spine. And then when I went to see him, his father was, this is in India, so they touch your feet, take almost blessing, you're somehow God to them, which is absolutely wrong. But, and then I operated on him. It was quite a difficult thing because all new place, new setup. There are 20 doctors inside the operating room, everyone crowding. And I was worried that the operation may not go as planned, but it went on. We put Barts and he did fantastic. Outside, when his father saw this, he was in tears. And that's the joy you get after treating it. But it was one of the worst one. The picture next to it here, it's not excavatum or funnel chest. It's a funny thing called arcuatum. It's where the breastbone is like this rather than like that. And that is very difficult to treat with NUS. It needs a different surgery, and sometimes implant is a good option. Then I was trying to show you in this is that how the spine and the breastbone is related. Often when you get this funnel chest, you can also have scoliosis or some rib problems. And because they are all linked to each other, and anything get a bit twisted, it can twist the other part. And there was a very complimentary letter I got from a spinal surgeon. He had a patient waiting for his scoliosis surgery, and I corrected his by NUS, and his scoliosis disappeared. He said, if I keep sending you patient for this, I will be jobless. It's like a complimentary letter from him. So it is just want to show that how it is linked, your breastbone to rib cage and everything else. I'll show you some pictures of a correction. This is one of my initial patients. See how dipped there? And now after the bar, he corrected. There are very tiny scars on either side. And that was amazing results, and he was so happy. And then I'll show you the bar. This is the vacuum bell. What it is like a circle. There are different designs. For girls, it's something narrow where the breast on either side. And that ball usually sucks the air out and gets your chest moving forward. But it's quite a cumbersome thing to wear. And can you imagine children wearing it? It's difficult, but it's an option, and I won't recommend it. But in some small group of people, it may be a good solution. The next to it is just to show that this is the implant called anatomica. We take a scan and we measure the depth, and on a 3D printer, we print out silicone implant, which goes. This is very popularly spoken about because the people who design this, they keep coming to your Facebook and put some information. This is called Pectus up, which is like a putting bar underneath. This bar is in front and pulls the sternum close to it. It's pretty new. We've done few, but we don't have long-term data on it. So without delay, I think I'll show you we'll go through the question and answer because that's very important for you guys. So the first one, which is said that, is it necessary to wait till age 16? Can it be done early because of anxiety? I think we can do. Donald Nuss is a professor, he's retired in America. He did it in around 12, 13 years of age. But we realized that you are still growing. Suppose if I operated on your child at 12, 13, and the bar gets shorter, or sometimes it can get misplaced inside. Or when you remove it, it can still, child is growing, it can go down. We do it for 15, 16 because it's the ideal age. Because if you keep the bar for 3 years, you stop growing and your breast bone and the ribs get very fixed, and that can work very well. But we can do around 15 is the earliest you should do. Sometimes, rarely, we could do it at 14. But I think under 13 probably should wait a year or two because to get a long-term result. Because and also the schooling system here, 15, 16 works better. But individual patient, I had a patient who, after discussion, I said, come after a year, you're 15, I will 16. He just stopped going to school. So mom has to call me, then I had to speak to him. I said, look, I will do operation on you, provided that you go back to school after the surgery. And if you don't, I'll come back and take your bar out. He agreed, and we did at 15. But otherwise, 16 is an ideal age. But we can do it at 15, but 16 is better. There is a question about, can we do Ravich? Yes, we can do Ravich. Ravich has been there for almost over 40 years. what we do is we cut you in the middle, take out all those dipping cartilages and lift your breastbone forward. I have not put any technical slides here because today is your day. And then it stays up. The problem with Ravitch is sometimes if a child is still growing, it can still sunk in. I have a series of patients after Ravitch come back with a dip and we have to do NUS in those. But in very selective cases, we can do that. Suppose if you got one chest, one side is uplifted and other one is depressed, then the Ravitch is a better solution. And even if you had a Ravitch before, we can still do NUS procedure. There's a question about a lady who's 47 and she had a severe Pectus Excavatum. She's got a breast implant and mastectomy. We can help. I think 47 is little older age, but we'll have to look at the CT scan. Oldest patient I did NUS procedure was 53. It's very painful, but that is possible. But we'll have to assess it. We do 3D scan and assess how, whether it's calcified, ossified ribs. If they're not formed into solid bone, we can still offer them a NUS, but it will be very painful at that age. Private, very limited waiting. The waiting list is because of the recently, because of COVID, a lot of private hospitals are taken over by NHS waiting lists. That is the only thing, but otherwise, there is a quick turnaround provided you are COVID safe for a private list. I think Ravitch cost is similar, but NUS procedure, if you're insured, often insurance covers it. But otherwise, it varies. You won't believe it. I'll tell you the prices across the continent. If you go to US, it will cost you around $60,000 to $70,000. If you go to Germany, it will cost you around 30,000 euros. If you go to Turkey, there's a colleague of mine called Mustafa Yüksel who does it. His personal fees are $10,000 and he charges around $20,000 to $25,000 to each operation. If you go to my teacher in Denmark, Prof. Hans, he charges around 20,000 euros. But if you come to us, in UK, we are reasonable. If we operate on you in any of the HCA big private hospitals, it can cost you between £8,500 to around £10,000. The cheapest one, we can do it at Barts, where the hospital cost is around £5,000. The bars itself and the stabilizer cost around £2,000. That's the reason the cost is. You stay in a hospital, especially with us, for 3 days in a hospital and around 6 weeks at home. But you can do most of the things other than weightlifting and heavy exercises. 6 weeks is a good recovery time. The bar stays with you for 2 to 3 years and then we take it out. There is another question about chest infection, fatigue with PE. We do see some of the younger patients or a child with a severe pectus, they have issues with breathing, they get a pneumonia often, and their pectus become worse because once you are getting respiratory issues, you pull your rib cage and you get this flaring of the ribs because of the diaphragm pulling it, and that can get worse. For them, the physio, good exercises, and eventually correction is a good thing. There is a question about severity of Pectus Excavatum or funnel chest. As I told you, that it's mild, moderate, and severe. Mild is which is almost like normal with little dip, and then it's between that Heller index of 3.2 is moderate, and anything beyond 3.5 is very severe. And then probably the treatment is a good thing to do. Then there is a how long recovery from NUS surgery. You're in a hospital for around 3 days. At home, by 2 weeks, you will have a pain. We give you 3 types of painkillers. One of them is paracetamol and ibuprofen, and one of them is probably morphine-related tablets. and 2 weeks you must take it because it could be very painful. But after 2 weeks, it gets better. Skinnier you are, the less pain you get. If you're very muscular, you will be more sore. Older patients have more pain, and usually you can start exercising between 4 to 6 weeks. And after 6 weeks, you can do most of the things. NHS funding stopped because of some silly thing. We got a different government now. Tories are always on sides of businesses and not for all of us. They felt that they want to do a sort of a meaningful, useless gesture, so that they are saying that, oh, we could ration it, who can get it and who cannot get it. They did a first consultation. We objected tremendously. We did a representation to MP, we wrote all of that. But once they tell you that they're going to do it, they usually do it, because it's not a question they're asking it. They're just doing a tick box exercise. They're already made up their mind. And they stopped it because they said there is no evidence show that it affects child. There are several evidence. I have given them evidence from different journals where it shows that there is a survival benefit. There is a paper from US called John Hopkins Institute, where they did a study of 100 years of death, and they found that if you get a Pectus Excavatum, deep, severe one, there is a chance that you dying under 53 is very high. This is just from a few cases from that autopsy results, but there are lots of evidence. The most important thing is psychological. Can you imagine that child almost excluded from everything? And it's very unfair, but we treat so many other unnecessary things, but curtailing. And the funny thing is, all over UK, we do one of the large number of mass procedure in Britain, but compare, there are around 6-7 centers do it. We do around 300 cases a year. Each funding, because I did all the studies on it, it costs 3,800 to NHS to do a surgery for your child. If you multiply 300 and 3,800, it's nothing. We can sack a couple of ministers and you can pay for all the treatment. Now they're given a 10 billion pounds for all the recoveries. Why stop this? This is stopped retrospectively in April 2019. And they told us in October that we stopped in April, but you can treat whatever you are in the books and you finish by April. And the people who involved on second decision-making place, they thought some of the decision-making people were thoracic surgeons. I wasn't one of them. If I would have been there, it would not have stopped, because I feel all the taxpayer for this country deserves the treatment. And it's your choice whether you go private or not. The treatment, nobody has a right to decide for you. It's you, and you only decide your treatment. But they did it. And some of my colleagues who thought that stopping this, they might get a lot of private patients and they can make some money. It's very wrong. And they're still now promoting as a saviors on different places so that they are going to protect. But I think they had a chance, and I have spoken to them very firm way that this is absolutely wrong, because it's a child. You cannot ration treatment for children, but people have done it. Yeah, if someone 40-year-old wants this treatment, you can ration out, but not for a child. I just want to show you, this is how the bar looks. This is the steel bar, and this is the stabilizer, prevent it from rotating. It's made of a tough stainless steel. I have helped them to design this part of it. It's around 11 inches. It can be 8-9 inches, and it stays inside between 2 to 3 years. This is called NUS bar. I thought I'll show it to you. So NUS, I think it's not finished yet. Sarah here has done a wonderful job. She's written a petition to our government, and they're being very lazy to reply to say that it's okay because we have got a backing. And then all of you should sign it up. If you get 60,000 more signatures, I have sort of primed some of the MPs who wrote to me about it, saying that if, in our democracy, MPs get a lottery ticket on Wednesday to ask Prime Minister a question. And I told a couple of MPs who I came across, say that if you get this lottery question, please ask question about treatment of Pectus excavatum. Because once it asks the question, Prime Minister, it has 3 months, they have to answer back all the treatment modalities and stuff. And then if they think that the inadequate treatment and inadequate consultation, then it becomes a white paper. Once it becomes a white paper, it becomes known, like government takes interest in your treatment. So we should all push it. If I think there are lots of you, 1 in 400, so there may be, and I'm telling you, no government in the world will take on the mums and survive that time, because if you decided to change things, you will make it happen. And I feel rationing is not fair. Your child deserves the best treatment. And once Sarah's things come through, watch it, sign everyone, and then we'll fight against the government. Last page there are some useful links, Sarah.
Sorry, there we go.
So there are, I'm just showing off, I have written, I got so carried away with the treatment. I'm actually busy cardiothoracic surgeon. Today only I had a major cardiac surgery, changing heart valve bypass. This started as a hobby and it's becoming such a big thing, mission for me. So I wrote a book on it. There are chapters written by one of my patients, and you could see his picture. He was so driven by treatment. I thought every book we write, all these old people, so-called doctors and smart people write it. But it's all about your patient. So I thought patients should write how they felt. We chose one is 16-year-old, another one is 40-year-old, and their experience in a journey with us, because it's very important how you feel, because all these books are fine. We can have a discussion. It's ultimately what you suffer from. There are all the contacts about the book, our contacts, my NHS contact. I have fought with my trust to see all the patients. They were trying to stop it. I said, no, the directive from commissioning is simple. They said, no surgical treatment is allowed for Pectus, but they have nowhere said that they can't stop. So I still see patients, and you won't believe it. I fought again with my trust, and they allow me to see any age group once a month, because children safety and all. I had once a month, I can still see child and give advice, because I have taken practice from GOS, other hospitals from Papworth. So these children I accumulate on once a month, and we have a consultation, and face-to-face, Zoom, not a Zoom, we do Skype or clinic call or phone call. I'm there at other end to answer all your questions and worries. And you must tell your child, there is nothing wrong with them. They are special new members of Avengers, because most of the children have a straight child. Your child has this done, so he's different. But of course, he's a special Avenger member. He can make your chest up and get people away. So always. And funny thing is, one of the child, when he had a nurse bar, his mother bought him a really nice T-shirt. You know what it said? Man of Steel, because he got a steel bar. So they put a Man of Steel for him. And I think it was quite unique. I'm here to help. And now it's your platform. Sarah, we have time for questions from people.
We absolutely do have time. And just to reiterate, Mr. Kolvekar, I am one of Mr. Kolvekar's patients, and I had the NUS procedure 4.5 years ago. So I was 36 when I had it put in. So I can, anyone on the forum that, you know, is considering surgery for themselves and is that bit older, then please do reach out to me directly if you want a patient's point of view. But also my son, who's 19-month-old, also has it, so at least I can tell him what to expect. And again, to Mr. Kolvekar's point about the petition, as soon as that becomes available, I will be posting it again. It's just that they won't let any more people sign it until they've reviewed it and approved it. So it's not me just sitting on it. I'm just waiting for the government to do that. We have got some time, so if anybody has any additional questions, I know one person on the forum did actually send in an additional question today, and that was around COVID, and actually whether children with Pectus Excavatum would be more affected if they got COVID.
I think we can use to our advantage, but we have not seen any evidence on it. Children by themselves are quite immunologically very strong, and they won't affect it. I have not come across, but we can use that argument to get a treatment for your child, because see, there is so much unknown about COVID. Every expert comes and tells you something different stories. There are as many experts as that as a population of this country, and they keep telling you different things. So there is no evidence. Don't worry about it. COVID will not affect your child unless you've been, if you're sensible, take all the precaution, all the washing hands and keeping, you'll be fine. But if he gets a chest infection, you must see your doctor and get a quick treatment for it, because like you and me, we can breathe out, cough out, but a child with a pectus will find difficult to do that. So if he gets a chest infection, you must see a GP and take his advice. And if you need antibiotic, do it, give them inhalations and fresh air, and that should help. But there is no evidence as such, or rather, I have not come across a child who has a pectus, affected by COVID and becoming unwell.
Thank you. If anybody else has any other questions, we have some time left. Zoom has kindly extended the time for me automatically, so I feel very lucky. So if you want to unmute yourself, if you do have a question, I guess we're just going to have to try and moderate this a little bit, because there's 21 people on the line.
I think there's a question.
I have a question, Sarah. It's Christina here. I joined a bit later, so I apologize if this was already brought up during Mr. Kolvekar's presentation. My daughter, she's 8 years old, and she has asymmetric, I'll say moderate at this stage, been diagnosed when she was 5. I've seen a consultant in London. We started using the vacuum belt since February this year, so just over 6 months. I've seen a slight improvement, but I appreciate that this is going to be a long-term treatment. What is your opinion on vacuum belt use?
I think vacuum belt works in a small group of patients. Very few people recommend this.
Correct.
And I don't know whom you saw, but it's been a sort of a very smartly marketed. There are 2 groups of people who do this marketing. One of them is a braces. There's a London orthodontic or something.
Yes, that's the one I use. That's the one I used.
They do these braces and stuff. Their braces who design is a South American chap who passed away now. He's no more. The person who sells you, he's a very nice guy. I think Sam or someone.
Sam, yes, correct. Yeah.
A lovely man. I met him. He will explain to you everything. But they are not all that effective. They are good. The braces are good. If you got this flaring of the ribs, it works magic.
Correct.
But if you got an excavatum, very limited effect. They do pressures here, pressure doesn't work. Cardiothoracic, it's superb. The vacuum belt is a very cumbersome and doesn't look like that effective. And can you imagine putting it on an 8-year-old child?
Yeah.
So we can't make 8-year-old child to sit in one place and read a book, let alone wearing. But your daughter must be fantastic to wearing it.
Well, let me share my experience. In fact, I was also very concerned about compliance, and she's been fantastic. So the first 3 months, it's painful. She uses it for maybe half an hour a day. She does have some marks on her chest because sometimes she does get some problems with irritation, etc. But I've seen especially in the last couple of months, she's been using it continuously for 3-4 hours whilst she's even playing, reading, and she doesn't have any more irritation in her chest, and her chest remains elevated for a prolonged period of time. So it goes back to normal after use, and then it will revert back to the same depression. I think I see this more of a maybe stopping the progression of the disease, which will occur during growth spurts, etc. So perhaps my hope is that it will stop the progression of this, of the appearance of this dent. But I would say that she's 8 years old, and she's really in the beginning wasn't very keen on using it, but now she's very good, and she can use it for 3-4 hours. That's my experience.
No, I think your child is fantastic. They can do very well. But the problem is she's still growing till 18.
Correct, yes.
What you can do, because basically, I think someday I'll give a name to the gene place where there is genetical marker for this. But basically what happens is your rib cage cartilage and the rib join together, and there's a junction, and there is some problem with the signaling to your body that growth rate need to control. And when it's not controlled, either it pushes your breastbone upwards or downwards.
Or down.
And in your little one's case, it's pushing downwards. And that force is still there. It's not gone. Good thing about this is that you can use it to make it less worse as grows. But
correct.
as she grows older, it may not work. And imagine once you get a breast developed, you need a different shape of it, and things like that. So it has a temporary use to it, but I'm not convinced that it's a good long-term treatment.
Sorry, could I come in for 2 seconds? Because my 14-year-old son has a vacuum valve. We see Mr. Ian Hunt in Surrey.
Okay.
I don't know if you know him. We thought we would with him, we thought we would try it for maybe 18 months, 2 years, to see, before we did any surgery, to see if it would work. So he's 14 years old now. Yes, I was quite shocked when I first saw it, because I thought, I don't know how he'll cope with wearing this. But he has built it up from 2 hours and then 4 hours, 6 hours, and now he wears it all night. He wears it in bed. And yes, there's a bit of mottling on the skin. At the moment, it's working really, really well. And the idea for us is to keep it going for as long as his cartilage and bones stiffen up, and see if it will stick. But I can let you know what happens. But that's just our experience so far. That he was the ideal candidate. I mean, he's very selective about which children should use this type of thing. And my son has sort of classic Pectus Excavatum, and it was, you know, just very symmetrical. So he fitted the bill to wear it. So that's our experience.
Please, may I ask if I can ask a question slightly as well? I almost feel as I want to take a ticket, because I want to be as patient as possible. But please, may I ask, we come from Bristol, so we've seen the gentleman at Bristol Children's Hospital. He's very kind, but did tell me that the funding had stopped, as we all know. He then said that he would send a referral to Ian Hunt. Apparently he's accepted the referral, and apparently my son has been given a hospital number for St George's Hospital in London. But we are none of the wiser, because I kind of felt really positive when I found this out. But after speaking to Mr. Hunt's secretary, I kind of feel as if we're still on the outside, and I'm just wondering, is this a positive sign that we are going to see him all the way in London? We're due to see him on the 5th of November. I presume that's for maybe a CT scan or whatever scan they have, or MRI. But I'm kind of thinking, like, is that got any positivity or any chance that he's still going to be seen, or possibly being given the chance for operation? Or does this mean nothing?
No, it's not nothing. You get a consultation from a doctor. He will see and tell you what are the treatments available. But having an appointment doesn't mean NHS has approved treatment. The way we can get it is something called IFR, individual funding request. But the people who are other end of IFR are similar to what you must have seen is computers say no. Out of 10 applications, maybe 1 they approve. Almost 9 get rejected, because they probably are instructed to reject it. I send everyone a very sad story. If you read it, you won't believe it. It's your own child having so much problem, but that's the only way this thing. Only time it succeeds, if you have to pursue it, you should write to your MP. And some of the MPs are very kind enough to give you supporting letter. And that works reasonably well, because once they support your doctor's application for IFR, I think give and take, if they're from a ruling party, your chances of getting a little higher than going on your own. Seeing Ian Hunt is fine, you can see him. I think important thing is he can tell you what else is available, what are the treatment. and but it doesn't mean you will get treatment on NHS. It only
Yes.
get, as I told you, the consultation is still allowed. So
Yes.
that's the reason.
Lovely. Thank you very much. Thank you.
Is it possible to speak? Is that
Yes.
okay? Sorry, we're also under Mr. Hunt. My son is 23. He had a CPX test done at Hammersmith Hospital. He's got moderate to severe impairment, and there was evidence that it says that he has an impairment, the evidence of impairment of the stroke volume. So therefore, when his heart rate is increased, the blood doesn't pump properly through. And that was evidenced through this test. So Mr. Hunt said that we would be on the top criteria for the operation. But I've subsequently had a phone call recently saying that although we're in the criteria for the operation, there's no funding, and they've discharged us, which I feel rather concerned about, because my son obviously has been shown to have having had tests and had an impairment, but now we've been struck off and discharged because of no funding. But it appears we've been, again, like the lady was just speaking a minute ago, that we've sort of been thrown out almost just due to funding, but the problem is still there.
The problem is still there because funding issues are there. And I don't know whether, have you had a chance to do IFR?
No, I didn't know anything about this at all.
It's called individual funding request.
Yes.
It only has to be done by your specialist. It goes to your council because that's where your commissioning body is. And there are 2 forms, and both forms are electronically sent, and they have once a month or once in something meetings. And all these, not just Pectus, there are so many other treatment goes through, and then small percentage of this on the evidence of things can go. Where do you live, madam?
I live in Sussex.
Okay, so you are in London anyway.
Yeah.
And if you have all those results, and if you want us to help you, I can help you. Ian, we work together. We have done some studies together. He's a good doctor as anyone you get. But I just feel more, and I will not make it as a commercial issue. If you have all the results, I know this morning only we were discussing with Hammersmith, one of the doctor who's involved in CPEX, and we are trying to do a study on CPEC tests so that we can get evidence and to do that. We're going to apply for this MRC trial where funding comes from research.
Yeah.
And we select patients on the research where they're paid for in treatment. So you do this and compare before and after. And if we can show, because the problem at present is there is no study in the past to show that it changes. All the study shows cosmetic. Even though we have in my book, there is evidence of cardiothoracic test showing that effect. You're absolutely right. There is a 20% reduction in stroke volume. That means your heart is ejecting, say, 100 mils every beat. In your child's, it inject around 80 mils. So there is a 20% less. And that will affect it. There is evidence, but the people powers to be selectively blind and not selecting it. So if you have all those results, and if you want us to help, we can help you on your IFR. There is an email there to Rukia. You can write to her, and we can help you.
Email, sorry.
In that last slide, there is
So
all
can you see
contact
this?
details.
Can you see the slides or not?
Is that yes, I can see the slides. Is that the
Useful
contact
link.
at yahoo.com?
No, it's the Rukia one. It's the NHS
Yeah.
contact
Oh,
at the
the
bottom.
NHS.
But
Not
IFR,
yeah,
it has to go through the NHS route. And then once you send a request, we need to at least remotely see your son.
Yeah.
And then we can help him with doing IFR. Do you know who's your MPs?
I don't actually know. I'll
Please
have to
find out. If
Yeah.
it's a Tory one, much better, because the ruling government listens to their MPs because it gives them a brownie point.
Right.
So the way to do it is that once we do IFR, I need a recommendation letter, and then we get a supporting letter from an MP. Then it has a better chance.
Okay, so my first protocol is to write to Rukia.
Write to us, Rukia, that's my secretary, and then we'll look through it. We need to see this thing, and you don't have to do anything. We can get all the results from Hammersmith and everything else.
They were done by Dr. Howard at Hammersmith?
That's fine. Hammersmith, I know who runs the CFEX lab, so we can get the results. Don't worry about that.
Okay, lovely. Thank you.
May I go next, please?
You tell your GP to refer it to us on my name, then GP knows where you are.
Okay, lovely. Thank you.
Can I just ask, I'm the Bristol lady, is that where I have to apply to as well, to your NHS contact? Or
Yeah,
I'm not sure where I have to apply for the IFR. Where do I need to go? Or do I go directly
your
to...
IFR will go through Bristol.
So I have to go back to my Bristol surgeon for him. Okay, thank you very much. That's
You don't need a Bristol surgeon. You can select any surgeon in United Kingdom who works for NHS, writes you, even if you are anywhere in England. This restriction is only in England, you know that. It's not restricted in Wales or not restricted in Northern Ireland and Scotland.
Kelly, sorry, Kelly, just to add, it might be best, your original referral probably would have come from your GP. So
yeah, it comes from the gentleman. I think his first name's Igor. He was the thoracic surgeon in Bristol Children's.
I think if you go back to where the original referral came from, and then request the IFR, that's probably the best.
That's lovely. That's why I wasn't quite sure.
But let's keep talking in the. We can take this outside of this meeting anyway, and Mr. Kolvekar, I'm sure, will help point you in the right direction. There was somebody else that just wanted to go. We've got a couple of minutes left, so
yeah, it was me. Thank you.
Hi.
It should be very, very quick, hopefully. My 13-year-old son, who was confirmed as having PE a couple of years ago, kind of at my insistence, I researched to see it's what it was. GPs conferred, etc. His chest goes in maybe 3 to 5 centimeters, but he's very reluctant to let me measure it or see him without a top on. He's had asthma since a toddler. He complains of palpitations. He also has resting tachycardia. I have monitoring machines for myself, for my health conditions anyway. So he has that. GP says it's cosmetic. I'm concerned. Am I overreacting, or should I push it further for a referral? And if so, can you recommend anybody near the South Yorkshire area, please?
Mrs. Cooper, I think it's very important you are not overreacting or exaggerating. You are a mom and you're worried about a child, and this is all possible because of Pectus Excavatum. Give and take, even if he doesn't have Pectus Excavatum, his anxiety of not having it also affecting him. So basically it's affecting him physically, it's affecting him mentally, and he needs to be looked at and treated at. If you don't get any chance from your GP, you can email it to us. We can see you remotely and advise you, and we can help you on that way. Yorkshire, I think because of these funding issues, majority of surgeons have stopped doing it. I still go to Wolverhampton, Oxford, Northern Ireland and Dublin and operate on some of the patients, but because future generation of surgeons will be de-skilled, because there won't be many left if it goes out of NHS. So I think you're not overreacting. You're absolutely reacting as any mom should be. It's very important to get looked at, because your GP is, even though he's a doctor, he's not a specialist. If your specialist says that it is cosmetic, then that's a different issue. But you must see a specialist. It doesn't matter whom you say. If you don't get any joy from anyone else, you can write to us and we'll help you as much as we can. We can even have a remote consultation, see you, your son, and we can advise. We can give you a letter. We can contact your GP. We'll help you out.
Thank you so much. You've confirmed my own thoughts. The GP just keeps trying to palm us off.
He doesn't want to spend the money even on a consultation on your little one. I think that's...
Yeah, and the silly thing is we have private insurance through my work, so we could possibly, wouldn't need NHS funding anyway, potentially. So
if you have a private insurance, your treatment is also sorted. I think there are certain group of patients. You got an insurance with your company where you work with?
Yes, and my son is on the policy.
So I think we need to have application there, but they usually fund it. I have done quite a few recently from Bupa and other insurance. They help. But I think that's by the by, it's not important. First thing is you need to see your little one, get it sorted, say that what it is. We do some test. We can do it remotely at Yorkshire from this end to that end, and we get to see all the tests, say that this is what it is and your worries, and we can tell you how much is the pectus affecting him or not. And just by this process, he will feel better, because people are giving serious thought to his not being well, and he will feel better about it. If needed treatment, we can help you out.
Thank you so much. Appreciate it.
So we're pretty much out of time, and I just wanted to thank everybody for joining this evening. I've thought it was really, really informative. Thank you, Mr. Kolvekar, for all the information and for answering the questions. And it's great to know that there's a link there that if people want to ask additional questions or get in touch with your secretary, or you via your secretary, then they can do so. So I will stop recording the teleconference. I'll make the recording available via a link on our forum as well. So if anyone wants to listen to that again, or if you know anyone else that couldn't make it this evening, they can also listen. But honestly, thank you, Mr. Kolvekar. It's been absolutely brilliant, and I'm sure everybody on the call's really grateful for your time this evening.
Yeah.
Yes, thank you.
Yes, thank you.
Thank you very much. Thank you.
Really great.